Terry Johnson from Marble City Pharmacy joins us this morning on a Monday, and it seemed like this time of the year, Jerry, we always talk about Medicare and Part D. Before we get to that, however, I noticed that Jacob's not with you, and rumors have it he's out at A&M, maybe looking at that job.
Listen, I think it's worth millions and millions, so good for him.
Speaking of millions and millions, millions and millions of questions about Medicare Part D. Let's talk about it this morning.
Yeah, this is open enrollment period. So I figured this is the best time to do it. Open enrollment started on October the 15th. The last day is December the 7th. That's the day you need to remember, December the 7th. So this is prime time for changing or enrolling new in a Medicare drug plan for next year. Those plans will take effect on January the 1st, but again, has to be done by December the 7th.
A, B, C, D. That's a mouthful.
It's a mouthful. It's confusing, right? So Medicare Part A, if you have when you turn 65, you'll get your red, white, and blue card, right? And so Medicare Part A is your hospital coverage. If you paid Medicare taxes during your working lifetime, you get that at no charge. Your red, white, and blue card also may have a line that says Part B on there. Your Medicare Part B you have to pay for. I can't remember how much it is this year. It's $100 and something a month, and that is your doctor coverage and your coverage for supplies and exams. If you get an MRI or something like that, or diabetic supplies, those are covered by Part B. I'll skip to Part D. Medicare Part D is your drug coverage. That's easy to remember, right? D for drugs. And then Medicare Part C, we'll talk some more about this in just a minute, also called Medicare Advantage plans. They take A, B, and D and lump them all together and then farm them out to a private company. So a lot to remember there, but I think it's important we differentiate between the ones.
So talk more about the prescription drug plan versus the Medicare Advantage plans.
Yeah, when you're talking about Medicare Part D, Medicare drug plans, you have two different options. One would be standalone drug plans. When you're looking and scrolling through the options, these are called prescription drug plans. So just remember, prescription drug plans or PDPs are drugs only. If you choose a drugs only plan, you'll have Medicare Part A, which you don't pay for. You'll have Medicare Part B, which you pay $100 something a month for, and then you'll have Medicare Part D with a separate premium somewhere, let's just say, most of them are $30 to $50. You know, you got some that are $70, $80, $90, $100. Honestly, those are a waste of money. Your Medicare Advantage plans, I said a minute ago, will take your Part A, your Part B, and your Part D and lump them all together, but they'll be contracted out to a different company. So you got companies like Blue Cross Blue Shield Blue Advantage, you got United Healthcare Complete, you got Humana Gold Choice, you know, on and on and on. So instead of showing your red, white, and blue card when you go to the doctor, you'll show your Medicare Advantage card, and again, it'll be your hospital, doctor, and drugs all in one.
Wow.
That's confusing, isn't it?
I tell you. So how do I choose which one's the right one for me?
Well, let me say this in the difference between the two. You're going to pay more money per month. If you have your A, B, and D separate, you're going to pay more money per month. A lot of people prefer that, though, because your Medicare Part B, they have supplemental coverage to that. Something like a Blue Cross Blue Shield C+. Not to get too far in the weeds, but your Medicare Part B only pays 80%. So if you go to the doctor, your Part B only pays 80%. You can get something like a C+ or a different kind of supplement that'll pay that other 20%. A lot of people like to leave it that way. So they have A, B, and D separate. That way when you go to doctor or hospital, you have a supplement, you just pay nothing, right? That costs you a lot more money per month. If you get a Medicare Advantage plan, which lumps everything together, your monthly premiums are a lot less. However, your co-pays when you go to the doctor or you get an MRI or something like that are more. So honestly, these things probably kind of come out in the wash, and some of it comes down to personal preference. Just understand, keeping them separate costs you more per month. Lumping them all together is a whole lot cheaper per month, but the co-pays are more.
Interesting. So this coverage gap, the donut hole, how does that work, and how can you avoid it?
Well, this is the biggest question that we get. So there's a certain period of time each year. If you take enough in dollars, if you take enough medication in dollar amount, cost of the drugs, you're eventually going to run into something called the coverage gap. Slang term for that, a lot of people call it the donut hole. The bottom line is this. Let's say you have a brand name drug that costs you $47 a month, right? You get to the coverage gap, all of a sudden now you're having to pay 25% of the cost of the drug. So you go for paying a flat fee to paying a percent. And let's just say your medication costs $400. That makes the math easy. That means you're going from paying $47 a month to paying $100 a month. What's worse than that is we have a lot of patients now on these injectable diabetes drugs, for example, your Ozempics or your Trulicities or your Mounjaros. Those medicines are about $1,000 a month.
Oh, wow.
So even Jimmy Dale, you can do this math. 25% of $1,000 is $250. So you may go from paying $47 a month to $250 a month. So a common question we get this all the time. What plan can I choose to avoid the coverage gap? The answer is none. So we have people who they'll change from Blue Cross this year to Humana this year to United Healthcare this year and on and on and on, trying to avoid the coverage gap. It's not possible. If you take enough medicine that costs enough money, you're going to get to the coverage gap.
It's ironic you mentioned that. I saw where several people on Facebook is posting about, well, they've been with Blue Cross Blue Shield, but they're thinking about this one and they're thinking about the other one. It can really be a challenge for people.
Now, that doesn't mean you shouldn't change or think about something else. I just want to be very clear about that. You shouldn't change to avoid the coverage gap because you can't do that.
Right.
Now, from year to year, the monthly premiums are different between the plans, right? Yours may go up to an unreasonable amount, or they may not cover the medicine that you're on. You know, these plans don't cover every single medication that's out there. So you need a pharmacist like myself, my brother, my other pharmacist to help guide you through, is my medication covered? If not, will I have to swap to another medication, and is that medication just as good as the one that I'm on already? Very, very, very important. If you don't have a pharmacist that will help you with that, then you need to come see us. Of course, in return, we want you to become our patient, but we're happy to help you with the process.
You know, it's got to be hand-wringing for you guys sometimes to, you know, you're trying to walk people through the process and you know, they've been your patients for a long time and you're trying to help them, but something you just can't fix.
Some things you can't fix. That's exactly right. And even my parents are on some expensive brand name medication, and my parents hit the coverage gap. Trust me, if I could get them out of the coverage gap, I'd get them out of the coverage gap. But I can't help them avoid that any more than I can help you guys. So yeah, it's difficult. It takes a long time sometimes to come up with the right answer because there are so many choices. There are probably 20-something drug-only plans,
wow,
and there are probably 15 or so Advantage plans. So when you go to the Medicare website, and some of you have done it for a number of years, so you can do it on your own. But when you go to the Medicare website, it's very confusing.
So it's not in my notes this morning, but you know, I'm still employed, but yet I get all this stuff in the mail. I mean, 2 or 3 pieces a day. Wanting me to do this and do that. What's the difference in being insured through your company and Medicare? Where does Medicare play in a role in this?
That's a good question. I should have put that on the list. Generally speaking, and this is probably true 95 times out of 100, generally speaking, if you are eligible for Medicare, somebody who's over 65, somebody who is disabled, somebody who has end-stage renal disease, those are the 3 ways that you get on Medicare. Most people get on Medicare because they're over 65. If you are still working and you're insured through your company, 95 times out of 100, it's to your benefit to stay on that plan. Very simple. Those plans don't have coverage gaps, right?
Yeah, right. So if my employer keeps a retiree Medicare plan, should we choose that?
Yes, okay, that's great. This is probably true 99 times out of 100. You do have some employers that will offer their own special Medicare plans. 2 good examples I think of off the top of my head are PHIP, your retired teachers, and the SEIB, which are your retired state employees. They have fantastic Medicare plans that don't have coverage gaps. Now, those are the only 2 examples that I know of. But just understand, if your employer offers their own special Medicare plan for retirees, don't get off of that until you consult somebody who knows, because it'll be better.
To recap, we've got what, to December 7th?
December 7th.
Okay.
The plans will take effect on January the 1st.
And so the questions are among many. Where do I go? What do I need to do? And I know you guys are seasoned veterans in doing this and answering questions and helping people, and that's what we want to do. We want to get to you, and you can answer their question maybe.
Yeah, and I'm glad you said that. I'll say this. There are a lot of people who have contracted with CMS, the Center for Medicare and Medicaid Services, who are advisors. I'm not really sure what they technically call them, but sometimes you'll see them, they'll set up at the local gymnasium or something like that. Those people are good and those people are helpful, and I'm not knocking them, but they're not your pharmacist.
Right.
There's just no way that person can have the level of expertise that you need to really make the right choice. I'm not saying don't use them, but I am saying also ask your pharmacist. So again, your pharmacist should be an expert at this by now. These drug plans have been out for almost 20 years at this point. If your pharmacist is not an expert, you need to find one who is.
Right before we go, it's vaccination season too.
Oh my, flu shots, new COVID booster, the new RSV vaccine. Those are the big things right now. We got all three of them, but you need to make sure you're updated on pneumococcal pneumonia for sure, and shingles as well.
All right. Jared, appreciate you coming this morning. And if you folks have got questions about Medicare and Medicare Part D or ABCD, get with Jared and Jacob at Marble City Farms. They'll guide you through the process, and you'll feel better about it, and maybe calm your frayed nerves a little bit. Jared, appreciate you coming this morning, man.
Yes, sir.
Gary Johnson from Marble